Good morning, Trinidad and Tobago. Happy Saturday to everyone. Welcome to the Ministry of Health's virtual media conference on the national COVID-19 response. We take the time 3 times a week to give you up-to-date and accurate information on the status of our COVID-19 response here in Trinidad and Tobago. And we encourage you, please, to use only accurate, reliable sources of information as we move forward into the vaccination rollout. It is important that everyone is well informed so that they can make the right decision for themselves and their loved ones. The members of today's panel are Dr. Avery Hines, Technical Director of the Epidemiology Division at the Ministry of Health, and Dr. Adesh Sergiosingh, Director of Women's Health at the Ministry, and I am Candice Alcantara, Manager of Corporate Communications. I will moderate the virtual conference this morning. We begin with a clinical update from Dr. Avery Hines.
Thank you, Ms. Alcantara. Good morning, Dr. Sergiosingh. Good morning to the members of the media and the members of the viewing and listening public. The clinical update for the day completed March 5th at 4 p.m., that's yesterday, is as follows. At that date and time, there were 98,523 tests completed between the public and the private healthcare systems. Of those, 7,729 positive results were returned, and of those positives, so far we've had 7,490 recoveries. There are currently 100 active positive cases, and those 100 are distributed as follows. There are 78 individuals currently in home self-quarantine, and we're going to speak a little bit more about that later on in today's press conference. There are 15 persons in hospital, and there are 5 in step-down facilities. There are 441 individuals currently in state and state-supervised quarantine. Those in hospital are distributed as follows. There are 11 individuals in the Couva Medical and Multi-Training Facility, 3 of whom are in ICU, and there are 4 individuals at the Scarborough Regional Hospital. The persons in the step-down facilities are all currently in the UE Debe facility. Now, we want to take a little time to speak about the patterns that we've been seeing. We have been speaking about the distribution in the communities. We had the CMOH come on and speak about that clustering that we tend to find within families. And that brings us to the point where we believe that it may be necessary to reiterate some of the public information on how to home self-quarantine so that we can reduce the risk of even transmission within the household and within the family, because it is possible. It is quite possible, and we've managed it successfully before, to have an individual in home quarantine and have them not transmit illness to other members of the household. There are guidelines on the Ministry of Health's website that give us steps, pointers, things that we can do to reduce that risk, and we're going to run through those in a little detail this morning. Now, the first thing about home self-quarantine is clearly that you need to remain at home. So when you are on self-quarantine, it doesn't mean you stay away from work, but you go about your normal daily activities, running errands, etc. And the temptation is there because quite frequently, if you're well enough to home quarantine, you don't feel particularly ill, but you are infected and you are infectious. Infectious meaning that you can spread your viral particles to other individuals and get them sick. Therefore, the home quarantine is to keep you out of circulation and to reduce the risk of you infecting other persons. So while you are in home quarantine, the first and most important thing is to stay at home. Next, even within the home, you want to isolate yourself from the other members of the household. Sometimes that's a little more difficult depending on how many people there are in the household, how many bathrooms, etc. there may be. So sometimes the sharing of facilities within the household makes it a little difficult, and you can actually indicate this to the county medical officer of health when they advise you can home quarantine, and between themselves and yourself we can assess whether this is practical in your setting and whether quarantine outside of your home in a state facility may be necessary in spite of the fact that you're reasonably well. So that is an option. Now, when you're at home, it is still necessary, if you're infected, it's still necessary for you to wear your mask. We know that this is a somewhat alien concept, but inside your home, you're trying to protect your own family members, and you're wearing the mask, you're following that instruction is actually doing a lot to reduce the spreading of droplets and the contamination of surfaces and the contamination of the air in the household. So all of those risk reductions help to reduce the chance of you then getting other people in the household ill. Clearly, if you're in home quarantine, you can't have people come over. So we can't have visitors, we can't have meetings, prayer groups in the house at the point in time when you are ill. Home quarantine means that the household is largely off limits for anybody apart from those who live in it. You can have food and medication supplies delivered to you. And between yourself and the county medical officers of health, those discussions on how you would organize those logistics, those can be ironed out in more detail so that it's practicable and sustainable. And then the physical hygiene component is very important. The keeping yourself within your bedroom or within your assigned space. It may not be the bedroom, maybe the living room. Wherever it is, you keep yourself to yourself. You sleep separately from the other members of the family to the extent it's possible. You use spaces at different times from other members of the family so that you're not all in the same space at the same time. The hand hygiene, the wiping down of the surfaces, all of those things actually help and have been demonstrated to reduce the risk of transmission within the household. Where those steps were followed, we found that one case in a household did not lead to family clusters. And we want to get that idea back at the forefront of persons' minds so that we don't have the clustering within the household when we have home quarantining going on. Now, clearly, you can have the situation where you did not know you were ill and you've already passed your illness on to other family members before the quarantine begins formally. So we know that there's a little margin of error, but we do want to continue to encourage people to do the best that they can to reduce risk of transmission. While you're in the household, there are things you can do. Open the windows in the house to improve ventilation. Some houses are air conditioned. We tend to leave the windows closed. We tend not to want insects to come in. Open windows, open doors help to do what they call air exchange. Exchange the entire volume of air through the house more rapidly so that you don't have infected droplets lingering, floating around in the air, and that reduces the risk of transmission. Clearly, not sharing utensils, towels, other personal effects is going to be one of the things that you emphasize, and not sharing that risk of transmission. Washing the things that we use, washing clothes, towels, etc., as often as possible also helps to reduce risk. And if at any point your health status is to change, if you start to become more breathless, more tired, more fatigued, if you start to have worsening symptoms of any sort, please, even in advance of the daily checks that the CMOSH will do, advise your county medical officer of health, or if it's even more severe than that, you can call the ambulance services, let them know you have been diagnosed with COVID-19, you're now having severe breathlessness or shortness of breath or anything along those lines, and the correct steps will be taken to get you into the right level of care as quickly as possible. The monitoring of the pulse oximeter, that little machine that they put on your finger to check your oxygen levels, that's an important daily marker, indicator of how well you may be doing. If those numbers start to fall, you again notify your CMOH so that you can be referred to the appropriate level of care. And in so doing, taking all of those steps really does help to reduce that transmission within the household while still protecting your health and ensuring that you get the level of care that you require. So we want to make sure that that information is, again, circulating, people are aware of it. So beyond the new normal for those who are not infected, beyond the new normal of maintaining your physical distance, wearing a mask when you're out, employing appropriate hand hygiene, and not crowding spaces, even workspaces, not going to workspaces or other gatherings when ill. Beyond that, part of the new normal is also reducing risk within your household, especially if you are ill. So we hope that that information continues to circulate, continues to be shared, and the information is available on the Ministry of Health's website. So you can always look at that, download it, print it, stick it up in the house so that you can remember the various steps. So I want to take a little time to just expand on that because it's an important area of transmission at this point. I'm going to turn you back over to Ms. Alcantara.
Thank you very much, Dr. Hines, for that important reminder. At the Ministry of Health, we continue to get questions from the public about COVID-19 and pregnancy, and of course the COVID-19 vaccine. We get these questions via social media, telephone calls, and just day-to-day interactions with the public. So we have brought Dr. Sergiosingh on the program again to provide additional information on this topic and, of course, to clear up some misconceptions.
Thank you, Candice. Good morning to Dr. Hines. Good morning to the viewing and listening public. Good morning to members of the media. So I have been on the program a few times, and I have been providing updates with respect to the effects of COVID-19 on pregnancy and the newborns. So my unit is called the Directorate of Women's Health, and we are part of the Ministry of Health. And we have been responsible for assisting in improving the healthy outcomes for both mothers and babies across Trinidad and Tobago. In 2020, we would have had over 15,000 deliveries in Trinidad and Tobago. 91% of those deliveries were managed in your public healthcare system, with 9% of patients delivering in the private sector. During that time, we would have, of course, had the pandemic in place, and we would have had to put systems in place to protect our patients, our staff, the relatives of the patients, and, of course, ensure that there was no cross-contamination of the system to keep our systems working. So unlike what you would have seen in international settings, in Trinidad and Tobago, our healthcare system, our healthcare workers performed exceedingly well in maternity and newborn systems, so much so that Trinidad and Tobago has continued to be recognized, and we continue to achieve what are called the Sustainable Development Goals for maternal mortality and newborn mortality. We achieve targets which are set for all the way for the year 2030. For the past 4 consecutive years, we've actually continued to achieve those targets. So with that start, I'd just like to go into some of the frequently asked questions that we are getting. And I'll just phrase them in the form of the questions. So the first question would be, are pregnant women at higher risk of severe COVID-19? So at the start of the pandemic, we gave different advice, but with the data and with all the publications that have come over the past year, we have changed the advice slightly. So pregnant women are now considered to be at slightly higher risk of severe COVID-19 disease. And this means they may be more at risk of being admitted to a hospital, to a high dependency unit, or to the intensive care unit when compared with the average healthy population. Now, there are some pregnant women who are at additional risk, and we must continue to highlight these. They're very similar to the other population, especially if you are overweight or obese, diabetes mellitus, high blood pressure, if you suffer from heart disease, if you are older for pregnancy. Again, these are young women, but if you are over the age of 35 years of age, and if you're in the last 3 months of pregnancy, that last trimester, we also see the higher risk of severe disease. The next question that we are also asked, again, I had COVID-19 during pregnancy. Will my baby be affected? And this, of course, is a very important question. In Trinidad and Tobago, we have so far had 41 women since the start of the pandemic who were pregnant at different stages of the pregnancy, and they have been successfully managed in our public healthcare system. So the evidence shows, again, from the past year of worldwide data, is very reassuring that there's little risk of the fetus being affected directly by the virus. So far, there are no known fetal effects causing harm to the unborn baby. The next question: does COVID-19 cause any complications to the pregnancy, to a pregnant woman? Again, we have some now recent data which suggests that there is a slight increased risk in these women, in pregnant women with COVID-19 delivering before they are full term. These are, of course, called preterm deliveries, and a preterm baby, having a preterm baby increases your risk of your baby needing admission to a neonatal intensive care unit. Next question: if I have COVID-19, where can I deliver my baby? At this point in time, and for the past year, all regional health authorities are equipped to manage pregnant women with COVID-19. If you are under the care of a private specialist in a private facility and you contract COVID around the time of delivery, they are mandated to refer you to your nearest regional health authority, and I can assure you our system will accommodate you. Do I have to deliver by cesarean section? That's another common question we are getting. And the simple answer is no. There's no reason if you have COVID that you need to have a cesarean section unless there is another reason. The next question is a multi-part question. I have COVID-19 and I've just delivered my baby. Is it safe to breastfeed? And I have COVID-19. Can I look after my baby? So, of course, your healthcare professional will guide you, but you can breastfeed and you can care for your baby once you are well enough to do so. You must follow all those public health measures which Dr. Hines just went through, including soaping of your hands, sanitizing, wearing your well-fitted mask at all times when you're caring for your baby. And of course, I want to remind you that breast milk is best for your baby. Another question or set of questions, they're all related. Well, it has to do with the vaccine. And I am pregnant. Can I take the vaccine? And the next question, I am breastfeeding. Can I take the vaccine? At this time, we are not vaccinating against COVID-19 in our pregnant women, nor in our breastfeeding mothers. And of course, you also heard that we are not vaccinating children under the age of 18 years. The emergency approvals for the use of these vaccines are being followed. We simply, in our country, we do not have enough clinical data from this population to guide us. However, currently, additional studies are ongoing. If there's an update, we will be providing that update in the future. The next set of questions, do I need to take a pregnancy test before getting the vaccine? Of course, we're talking about a woman here for all of these questions. After taking the vaccine, I then found out that I was pregnant. Should I worry? So the first thing is, of course, do not worry. And the Ministry of Health does not advise taking a pregnancy test before accepting the vaccine if you, of course, qualify for the vaccine during the rollout. However, if you find out that you are pregnant after being vaccinated, or you become pregnant in between the dates of the first and second doses, I want to reassure you that based on the safety profile of the similar vaccines we have used in pregnancy programs in the past, there appears to be minimal risk to you or your baby. Now, some countries have chosen to vaccinate high-risk pregnant women, and you'll see this reported in the international media, United States, United Kingdom. And they have chosen to do so. They have taken a policy decision based on their extremely high levels of COVID-19 in their population. They have taken that risk. The next questions are related to fertility treatment and trying to get pregnant. Can you take the vaccine whilst trying to become pregnant? Will the vaccine affect my fertility? Will the vaccine affect the DNA of myself or the DNA of the fetus? Will the vaccine affect my placenta? You can take the vaccine once you are in a high-risk category. Of course, these are women trying to get pregnant. If possible, however, you should try to complete the vaccination before undergoing fertility treatment as guided by your healthcare professional. If you can, and you are high risk, remember I said obesity, uncontrolled high blood pressure, diabetes, it is best to delay your pregnancy, get vaccinated before, get healthy before getting pregnant. I also want to assure you the vaccines do not interfere with your fertility or your future fertility. Additionally, none of the technology involved in the vaccine can affect you, your DNA, your baby's DNA, or interfere with the placenta. Now, the last topic would be if a pregnant woman, of course, if I cannot get vaccinated as I am pregnant, how can I protect myself? What should others do to protect me? Basically, everyone, including the pregnant woman, including your family, including the staff at the hospital, everyone should follow all these public health recommendations. Now, if other family members around you qualify for the vaccine, please, they can be recommended to get vaccinated as soon as possible and it's available. The more persons who get vaccinated in our society means the less chance that the unvaccinated population will be exposed to the virus. We need to build that protective barrier around our pregnant women, around our breastfeeding women, around our young persons, of persons who have been vaccinated. Thank you very much.
Thank you very much, Dr. Sergiosingh, and I know that your presentation would have allayed many of the fears of our pregnant population and women who are breastfeeding. And of course, there was advice there for loved ones, family members, those in the household bubble of persons who are pregnant. And I think that also should be extended to persons in the workplace. If you are working with someone who is pregnant, remember that you have a responsibility to help protect them as well. We go now to the question and answer segment of this morning's media conference. We ask our media representatives to indicate your name and the name of the media house that you represent before posing your questions. We ask for no more than 2 questions at this time, please. And of course, if time allows, we will accept additional questions from media representatives. We begin this morning with questions from CNC3 of Guardian Media Limited.
Hi, good morning. I'm Sweeney Gray from Guardian Media. My question is for Dr. Hines. Dr. Hines, you've been taking very detailed demographic data throughout this entire process. There are 2 reports that came out this week, and I just wanted to know if you've noticed those patterns here in Trinidad and Tobago. One, that obesity has a higher than previously realized factor in the mortality rate for COVID-19, and that the Caribbean has the highest rating of obesity in the Americas. And I wanted to know if you have noticed that pattern in Trinidad and Tobago, specifically that obese people are, after the elderly, the most vulnerable to COVID-19 or highly vulnerable to COVID-19. Thank you.
Okay, thank you for your questions. Now, obesity is known to be a risk factor for more severe illness in other respiratory illnesses as well, not just COVID-19. So it's not a COVID-19 pattern so much as it is a respiratory illness, a viral respiratory illness, or a bacterial respiratory illness issue. And yes, the patterns that we see worldwide apply here as well. So those who are obese are counted among the persons that have higher risks of having severe illness. Now, I'm not 100% sure that the Caribbean has the highest rating of obesity in the Americas, given the United States of America itself and its levels of obesity, but we do know that the Caribbean countries all have noted over the past maybe 15 years or so in doing their risk factor surveys for chronic disease that obesity is an issue that needs to be addressed. For that reason, all of the healthy population move into shape, get moving, move with us campaigns have been a recurring feature. So yes, we do see obesity as one of the risk factors. We do want to encourage all persons to look at reducing the risk of not just COVID-19, but the risk of other non-communicable diseases that are currently ravaging the global population by addressing those risk factors, addressing dietary intake, addressing the body mass index, looking at the physical activity. All of those things are going to help. So yes, obesity is an issue. Yes, it is a risk. And it is one of the things that we can actually change our behavior and therefore change our risk. So we want to make sure that people are continuing to do that even as we deal with the other aspects of the pandemic.
Thank you, Dr. Hines. We go now to AZP News, please.
Good morning, Private Harry, azpnews.com. My first question, Dr. Hines, do we have any cases currently of Miss C among children? And can you tell me how many of those cases we have had have all these children recovered and recovered properly in terms of have they resumed normal activities? And to Dr. Sergiosingh, I know recently you spoke about there might have been an increase in births in the country because of COVID-19. Can you give us an idea about the number of births we had last year compared to the previous years? Thank you.
Okay, thank you, Mr. Bihari. I believe that Dr. Joanne Paul has been on the program on a couple of occasions speaking about exactly that, the Miss C, that is that multi-inflammatory syndrome, multi-system inflammatory syndrome in children. And she has indicated that, yes, we have had a few cases. The updated numbers will be best provided by that pediatric unit. The outcomes so far have all been positive, and we are grateful for that. The management has been successful, so all of those people are in various stages of recovery. And for that reason, that's one of the many reasons that we want to continue to protect that under 18 population, even though they can't be vaccinated at this point in time. The risk of, and the fact that we have already seen the appearance of Miss C in our pediatric population, in our under 18s, means that we do need to be extra careful to reduce the risk of transmission to that population by all of the non-pharmaceutical interventions that we've been employing, including the very careful management of the education versus protection dynamic. That's why we currently only have those older students out at school at this point in time, the 15 to 19 age group, whom we believe can, to some extent, participate actively in reducing their own risk, even while enhancing their readiness for the examinations. That's the only age group that's currently in circulation. And if we look back at those pyramids that we would have seen, those demographic pyramids, we would see that the bottom half of the pyramid, representing the younger age groups, is the age group that that grouping that we've managed to protect. They've had much smaller numbers of cases proportionally than the proportion of the population they represent. That under 19 population is about 29% of the total population, but it is about 9% of the total COVID cases. So yes, Miss C is a threat. We are very aware of it, and we are trying with all of the non-pharmaceutical interventions and public health measures to continue to protect that age group, even though they can't be vaccinated at this point.
So the question you asked was related to the whether there was a change in the number of deliveries that we had from year to year. So firstly, I'll say, well, for the year 2020, we actually had a few hundred less deliveries than we had for the year 2019. But then in 2019, we also had a few hundred deliveries less than 2018. So the trend is that in the last few years, and probably since we've really been looking at these statistics, the population numbers have been declining over time. And in the last few years, we actually continue to see that slight reduction on a yearly basis. Some years it may see an upward trend. The reasons behind all of this, we are not always certain, but you can look back in terms of in the 1980s, for example, we had well over 25,000 deliveries on an annual basis. In the 1990s, we dropped to 20,000 or so annual deliveries, and now we are hovering around 15,000 deliveries on an annual basis. And we know some of the things that have contributed to this would be a later age for women to start their family because of education, greater access to family planning methods as well would also have contributed. But specifically with respect to COVID-19, the simple answer, we haven't seen an increased number of births in Trinidad and Tobago. I have statistics just up to January 2021, and it's actually lower than January 2020. So we may be continuing to see that decline. Thank you.
Thank you very much, Dr. Sergiosingh. Just following up now on a point you raised earlier, you mentioned that there were some adjustments in the maternal system, the maternity system within the public healthcare system. Can you just advise us on what are some of the modifications that were done as a result of COVID-19?
Okay, thank you, Candice. So specifically with respect to COVID-19, as you know, we created this parallel healthcare system to handle our patients in Trinidad and Tobago, to take them out of the system, the normal healthcare systems. However, we couldn't do this specifically to recreate maternity units. We couldn't recreate neonatal intensive care units at Couva, Quora, and any of the other parallel healthcare facilities. So what we did was, within the existing facilities, we created a number of new protocols, a number of new areas to ensure that there were isolation areas, PPE, staff were trained, so that therefore all our main maternity units actually have designated COVID-19 areas to manage patients in delivery, as well as to safely care for that newborn baby in case they were delivered to a mother with COVID-19. And as I said before, we've had to do this successfully on several occasions. We actually have had a few very critical women who have ended up in our high dependency units and intensive care units. But what would have happened, they would have delivered in the traditional maternity units, and then after the aftercare would have been done at the Couva facility. In Tobago, mind you, there have not been any women who have had COVID-19 in pregnancy to date. Thank you.
Thank you very much, Dr. Sergiosingh. I think we have a question from TV6 now. TV6 to Ms. Cutting.
Hello.
Wonderful. We can hear you. Good morning.
Good morning, Renessa Cutting, TV6 News. I'd just like to find out what is the optimal ratio of births versus deaths per annum. I don't know if there's a preferred type of balance there. Is this declining trend of births something that we should be concerned at this point?
Okay, so I think that question again was directed to me. Thank you for the question. So for a population, we're not considering emigration and immigration, persons exiting the country and immigrating into your country. When it comes to having a static population of your local population, the number that you should be every couple should have 2.1 children for excess deaths in your population to have a static population. Over the years, actually, we have fallen to, that number is called the fertility index. It's actually fallen to 1.6 in Trinidad and Tobago. So if you just look at the local population and you keep those numbers going, we are going to see further reductions in our population. Higher than this, of course, this will be considered by our planners in terms of what does this mean to the economy of Trinidad and Tobago in the future, in terms of having a base that can support pensions and these other issues, schooling. So, of course, these are high-level discussions that will have to take place for the policymakers. So, thank you for that question.
Thank you very much. I just wanted to follow up. At the last conference, we had Mr. Sergiosingh on, and he's the GIS manager of the Ministry of Health and works directly with Dr. Hines. Just wanted to get a sense of how is the information from the GIS system being used to make decisions that have national impact, policy decisions, treatment decisions. How does it change the way that we do our work in the Ministry of Health? I think that's a question that probably Dr. Hines can expand on that will give some insight into the work that happens behind the scenes.
Okay, thank you, Ms. Alcantara. Now, as you're aware, the GIS team, that Geographic Information Systems team, is actively supporting all of the COVID-19 response with the use of its geographic mapping and collection of layers, literally, of information on the cases as they arise in the population. So we can, with that system, we can look at patterns of spread that go even beyond just the geographic. What we currently show, what we demonstrate in the maps, is the living areas, the places where the individuals who have been diagnosed positive will be, where they reside, what their address is, bearing in mind that that may not be where they would have contracted their illness. So when we do the contact tracing, when we ask the questions about your possible movements in the previous week or two before being diagnosed, the information that's being sought is being sought for two reasons. And that information helps us to identify patterns in where people may have gone, places they may have visited that they weren't aware of particular exposure risk. It also helps to let us know where they may have exposed others, so that if they have gone in the time frame when they were ill but unaware of it to various locations where other people may have been gathered, that information is also mapped, that information is also shared, so that the follow-up, the tracing of other potentially exposed individuals can be expanded to the people who would have been at those areas at that point in time. So there's a lot of that activity that goes on behind the scenes with the case investigation and contact tracing, tracing both forward and backward. Forward meaning, who have you possibly exposed since you've been ill? And also backward, who have you been exposed to in the time frame before you became ill that could be a source? Now, as we've said before, if the people that we're interviewing aren't forthcoming and sharing all of the info, that tracing backward is going to be affected by the quality and the completeness of the information shared. But we still use what we get to help to identify potential risks and potential sources of exposure, so that we can trace, track, and then contain any additional cases that may arise. So when the questions are asked, when the phone calls come, when the requests for additional information for someone to come in for testing, etc., are made, they are all being made with the intention of reducing the risk of transmission and also identifying where people may have been exposed, so that we can reduce risk in that manner. In that way, we were able to identify where super spreader contexts were identified within our own population, and to advise on how to reduce those risks. So getting that information, putting it together, understanding where exposures are more likely to lead to transmission or less likely, those bits of information at a geographic level also help us to form a better picture, for want of a better word, form a better picture of that risk profile, and therefore how to reduce risk by intervening, how to advise people to change behaviors to reduce the possibility of becoming infected or the possibility of transmitting infection further. So there's a lot of very active collaboration between the GIS unit and the county medical officers of health as we look at containment of potential infections.
Thank you, Dr. Hines. And we go to ACP News for follow-up question.
Good morning again. I just wanted to follow up the request that was made by the conservation groups for turtle nesting. Beaches are closed at 6 p.m. If any news, if any more information has been made concerning their request.
Thank you, Mr. Bihari. The matter has been noted, and it will be addressed via the appropriate channels. Thank you very much. I think at this point, I don't see any other questions from the media, and I think this is time that we can wrap up this morning's media conference. Thank you, everyone who has participated this morning. We had Dr. Sergiosingh with us, Dr. Hines, and members of the media, the team here that's working behind the scenes. Thank you, everyone, for all that you have done this morning. As we close, remember that together we can protect our loved ones from the COVID-19 pandemic. Dr. Sergiosingh this morning discussed some of the ways that we can help to protect the pregnant and breastfeeding population. He clarified some misconceptions and some concerns that are raised from that group. We also had Dr. Hines reminding us that even in the home, we can protect our family and other members in the household with us from COVID-19. Therefore, we all have a part to play. We've been doing a great job. Our numbers are low, but we all have a part to play to create that protective barrier, especially around the ones who cannot get the COVID-19 vaccine at this time, the pregnant population, breastfeeding mothers, and of course, our children. Everyone, please remember to do your part. As we close, we go to a video from the World Health Organization. Please be safe and wear your mask.
We hear a lot about COVID-19 and symptoms in grown-ups and adults. How does COVID-19 impact children? Welcome to Science in 5. I'm Vismitha Gupta-Smith, and this is WHO's Conversations in Science. We're talking to Dr. Maria Van Kerkhove today about COVID-19 and children. Welcome, Maria.
Hi, Vismitha. Thanks for having me.
Maria, tell us about symptoms of COVID-19 in children. Are they any different from grown-ups, especially in the very young ones?
So this is a really important question, and we continue to learn about SARS-CoV-2 virus, the virus that causes COVID-19. There are different types of disease presentation based on the age of the person who is infected by this virus. Luckily, children and adolescents tend to have more mild disease compared to adults. Most people who are infected with the SARS-CoV-2 virus have respiratory symptoms. They start to feel a little bit unwell. They will have a fever. They may have a cough or a sore throat or sneeze. In some individuals, they may have gastrointestinal symptoms. Others may lose the sense of smell or the sense of taste. Especially in the youngest children, they tend to be more mild, which means they don't have as many symptoms as adults do. Some children may have gastrointestinal symptoms like diarrhea or vomiting, but they tend to be more mild. And even most children tend to have asymptomatic infection, which means they don't have any symptoms at all.
Maria, we're hearing a lot about these variants now. What are we seeing in children? Do these variants have different symptoms? Are they impacting children in a different way?
So virus variants mean changes in the virus. And we are detecting changes in the SARS-CoV-2 virus over time. This is expected. Many of these changes do not have any impact on the virus in terms of its ability to transmit or the disease that it caused, but some variants we call variants of concern. And these viruses need more study. And scientists are looking at the way the virus transmits, the disease that it causes, and luckily so far, these variants do not tend to cause more severe disease across any age group. The disease presentation looks the same, and the severity looks the same as the other SARS-CoV-2 viruses circulating. In terms of transmission, the virus variant that was identified in the United Kingdom, they noticed an increase in transmissibility across all age groups. This includes increased transmission among younger children as well. In the area where this virus variant was circulating, schools happened to have been open. And the virus that was circulating also circulated among the students and the faculties in those schools that were open. So there's much study that's still underway with these virus variants, but the studies in the United Kingdom, for example, do not indicate that the virus specifically targets young children, meaning that it's not infecting children more than would be likely of other viruses that are circulating in the area.
Maria, we don't want to worry mothers, fathers, and caregivers, so give us some tips about how to keep children, especially the little ones, safe.
The best way to keep children safe is about prevention. We want to prevent as many infections as we possibly can all over the world. And it's about doing it all. The comprehensive package of interventions that you hear us talk about all the time apply to children as well. Making sure children have clean hands and they wash their hands appropriately with soap and water and sing the song so that they get enough bubbles and they make sure that those hands are really clean. Or use an alcohol-based rub. Make sure that they practice respiratory etiquette where they sneeze into their elbow. Even my littlest one, who's 2 years old now, will cough and sneeze into his elbow. But these are good habits to be forming for children as they get older. Making sure that if they're age appropriate and they follow the local guidance to wear a mask appropriately. With clean hands, make sure that the mask is put on over your ears, covers their nose and their mouth, and that the children don't touch the outside of their masks. Make sure that they have clean hands, and then when they take it off, to clean their hands as well. Making sure that you as parents talk to your kids as best you can, answering their questions. There's a lot of confusing information out there and it's scary, so find the time to talk to them and answer their questions and alleviate their fear, and make sure that they get good information from you. And probably the most important thing that everybody can do is physical distancing. Outside of your immediate family, make sure that you keep your distance from others. That's the best way to prevent the spread of SARS-CoV-2.
Thank you, Maria. So parents, remember you have a whole toolkit of precautionary measures. Make that part of your daily routine and a habit for your children. And also, please share this information and other science-based information with your networks of parents. Until next time, then, stay safe, stay healthy, and stick with science.
As a father and a husband, I believe it is my role to protect my family. As a Trinbagonian, I also have a responsibility to my fellow men. We can't protect our loved ones and our country from COVID-19 if we all wear a mask over our nose and mouth in public, stay at least 6 feet away from others, stay home, especially if we are ill, wash our hands often with soap and water and use a hand sanitizer, cover our coughs, avoid touching our face, and clean and sanitize the surfaces that we touch often. Everyone must do their part. This is why I follow the new normal.
A message from the Ministry of Health.